All right, hey everyone, welcome back to the second day of STEMathonX. Today we have Dr. Ricupito with us, and he's an orthodontist. Do you want to introduce yourselves real quick to everyone?
Yeah, hi. My name is Dr. Michael Ricupito, and I am a board certified orthodontist. Trained here. All my training is actually in California, and I've been in practice for 35 years.
Okay, cool. So let's just start with the basics. So do you think you could give us a brief breakdown of your occupation and why it's so important in today's day and age?
Well, I mean, first, let's talk about education. I think to become an orthodontist, it typically requires a 4-year bachelor's degree in biology. Just to be familiar with all the biological sciences. However, it's not necessary. My son's actually in dental school now, and he was an economics business major. So as long as you do your prerequisites, you can apply to dental school. Dental schools are typically 3 to 4 years. So, well, the University of the Pacific in San Francisco is the only 3-year, all year round program. So typically to become a dentist licensed in the United States, it's an 8-year process. And then to become an orthodontist or one of the recognized specialists, which is, oral surgeon or periodontics or pediatric dentistry, that's an additional 2 to 3 years. So it's a long road to become a specialist in dentistry. However, a very rewarding career. And I don't think I'd change it for anything. And your question was, I'm sorry.
Oh yeah, I think you answered my question pretty well. And yeah, I can agree that orthodontics is really important, especially because lots of kids get like braces nowadays.
Yeah, what we need to understand about orthodontics, it's just not teeth getting straight. But the most important thing we do in orthodontics is we're dentinofacial orthopedists. And when I say dentinofacial, dentin, obviously the teeth, and facial are the facial structure bones. We actually change the relationship, the way the upper and lower jaws grow, similar to what an orthopedic surgeon would do for someone who had a crooked spine or a broken bone. We don't actually break the bones. We actually help growth guide and manipulate the bones into the proper positions.
Yeah, that looks like it requires a lot of training. So I want to ask you this, what do you think the most difficult part of dental school was? Because many people who go into dental school sometimes are scared that it could be really challenging.
Well, I think that if you do well in your biological sciences as an undergrad, I think that you'll do well in dental school. It's a commitment. It's truly a commitment of time, energy, and resources. But you have to remember, you're spending this time, energy, and resource on the most important person on this earth, and that's you. And so if you really dedicate the time and energy to be the best dentist you can be, you'll obtain that. Dental schools want their dentists to be successful. And as long as you're spending that time and energy, you'll do well.
Yeah, so you mentioned a lot about time and energy, and obviously being a dentist requires a lot of time and energy, whether it's performing certain procedures or just taking care of patients in general. Whatever you're going to do, it always takes up a lot of time and energy. Have you ever, while we're on the topic of time and energy, have you ever had to stay overnight in your hospital to complete a procedure or to operate with patients?
No, typically orthodontists are not hospital based. Most dentists work out of their own hospital, which is their own office. And what's very unique to dentistry is we have self-contained operating rooms. So when you go to the dentist, it has the evacuation, it has the hand pieces, it has all the sterile equipment. So we basically run our own hospitals. The times, if you do a residency in oral and maxillofacial surgery, there's times that you would have hospital-based events. When I do procedures of preparing jaws to be broken and moved around by oral surgeons, I will stop in at the hospital and check on my patients. But generally, there's not a lot of hospital time spent as a dentist or orthodontist.
Yeah, so you mentioned you had your own clinic, and obviously with the whole COVID-19 pandemic, it's a lot harder to perform in whether it's in a clinic or a hospital, and especially for an orthodontist where you're getting up close with the mouth and any sort of nasal areas as well, it's probably especially risky. So could you explain how COVID kind of impacted your job and especially the way you worked in your clinic?
Well, COVID's been a huge impact on the world in general, and I don't want to downplay its significance nor its danger, if you will. But quite honestly, I was trained in the late 70s and early 80s in San Francisco, where the majority of our patients had a thing called AIDS, which didn't even have a name. It was called Kaposi sarcoma. So I tell my patients, when you take universal precautions, which that's what we're trained to do, COVID falls right into that lump of tuberculosis, herpetic lesions, a variety of communicable diseases. And so the sterilization process, which we call universal precautions, can eliminate or mitigate any kind of transferring of these disease processes. But yes, it's much more difficult because this is so little is known about this disease and its transmission. We think we know how it moves because it's a virus and it's on mucous membranes. Regardless, we take the same precautions, but we've taken even greater precautions in that we've separated, we've had social distancing. We've upped our sterilization procedures for, the floors and the seats and some of the other stuff that we didn't see as significant because we wanted our patients to feel at home. We wanted them to know that their health was our number one concern.
So in the previous question, you talked about like hospitals versus clinics. And since you have your own clinic as well, what do you think the benefits of having your own clinic are opposed to being part of a larger hospital?
Well, when you are part of a larger hospital, you're basically renting space there. Okay. And the procedures and the cost for providing a service is much different than running your hospital. If every dentist had to have an operating room to work on their patients, hospitals would be inundated. When dentistry first started, it was a branch of medicine. So everything was hospital based. But we learned that we could set up our own clinics, i.e. our own offices, provide sterile procedures and perform the duties that we need to do as dentists.
Yeah, that sounds pretty interesting. So I'm going to switch topics. I saw on your resume that you were the previous president of the California Association of Orthodontics. So do you think you could talk a little bit about that and what exactly that was and how you impacted other people as being a president?
Sure. First off, I think it's worth noting that I'm passionate about my job and my profession. I'm an adjunct associate professor at the dental school in San Francisco. And so I teach there. I have my own 2 practices in which I have a robust clinic practice, but I've always been involved I've always thought that giving back to the profession is very, very important. So I have worked with our specialty groups, which is the California Association of Orthodontists, made up of approximately 2,000 orthodontists in the state of California, to look at policies, procedures, and to be able to create continuing education so that our profession can grow and be the top-notch cutting edge. So in 2004, after becoming the secretary and then vice president, I was elected president of the California Association of Orthodontists. And I remain on their board of directors now, working on a variety of different committees.
Yeah, and on top of all of that, you also mentioned that you were a professor, and that's also what's on your profile, as Maher mentioned. How do you like working with kids, and what do you feel like the future of orthodontics is going to be?
Well, you know what? I'll tell you. Again, if you can't hear it in my voice, I'm passionate about my profession. I've wanted to be a dentist my whole life. My father was an engineer, aeronautical engineer. I did not want to be an engineer. he just didn't seem to like his job. My Little League baseball coach was a dentist, and he seemed to like his job. And with that, I set out to become a dentist. So along that same thread, we have a saying in dentistry: see one, do one, teach one. So see it done, do it, and then teach someone how to do it. And in the thread of teaching and giving back to the profession, it was just a natural event for me to want to give back to the university. So I find it extremely rewarding. The doctors that I work with there, they're new doctors. Their thirst for knowledge is incredible. They test me because they're asking all the contemporary questions, and yet I try to bridge the gap to have them relate to what an experienced orthodontic event is versus what they're learning in a textbook. So I find their thirst for knowledge invigorating and exciting.
Yeah, and just based upon what you said about contemporary knowledge, do you feel that the field of orthodontics has changed since maybe like a couple years back to where it is now?
That's a great question. If you look at orthodontics, or the biomechanics of tooth movement, we are engineers. We are bioengineers, and the moment to force ratios and the gram forces needed to move a tooth aren't going to change. Those are just the building blocks and the foundations of tooth movement. But what has changed is technologies. Technology has advanced our ability to treat faster, better, and to gain greater results. And I'll give you an example of that. We used to use, stainless steel wires that have the very, very high or low modulus of elasticity. And then nickel titanium wires came that are very flexible and that allow the teeth to move in a very biologic, healthy way. Scanners have come along now where we can 3D scan the mouth instead of taking impressions, which are accurate to 11 microns. There's Invisalign that's being used that has its place in orthodontics by being able to, I think, accurately move teeth in certain cases. So there's been a lot of advances in orthodontics to allow the delivery systems to grow, yet we have to rely on the foundational component. You need to diagnose the case. You need to figure out the proper methodology to treat the case. And then you have to implement these tools in your toolkit to be able to get a final result that you're happy with.
So you mentioned that like tech has rapidly advanced, and since you started working in this field like many, many years ago, the explosion in technologies like completely changed the way orthodontists work. But where do you see like tech and orthodontics in like the next 10 to 15 years? Like, do you think that AI and robotics will have an impact on the way you guys work?
Well, I think that right now, that's an excellent question. I think just the use of scanners and being able to create algorithms for reliable programs for the movement of teeth has ramped up our ability to treat. And there are companies now that are using robotic devices to bend the wires and to create methodology in which it eliminates the human error component. So I don't know what the next 10 years is going to bring, but I do know technology is going to heavily impact it.
Yeah, that definitely makes sense. Like, I think almost all fields have been impacted by technology, like whether it's the medical field or other industries as well. And like speaking on like technology and math, you talked about how lots of physics and almost engineering is involved in orthodontics. So do you think you could expand on that a little bit?
Yeah, sure. Orthodontics is a pathologic event under controlled circumstances. So let me define that. Pathology is not good. It's the breakdown of a body part or an element of the body. And so when we do orthodontics, we are pushing a part of the tooth, which is breaking down bone, which is the pressure side. And on the tension side, there's going to be a vacancy, and the body does not like pressure and it doesn't like tension. So it'll remove bone, and on the tension side, it'll have bone be made. So when it comes to the movement of the teeth, there's certain principles that you cannot change. For instance, if you broke your arm and the orthopedic surgeon said you're going to have a cast for 6 to 8 weeks, you would never say, well, I only want the cast for 2 weeks because I've got a baseball game I want to play in 2 weeks. Bone heals. Bone takes time to heal. So these same principles in the body are the same in the mouth. So there's certain things we can't violate. But what we can do is create systems through technology and through good research to augment and facilitate our ability to deliver a more reliable healthcare product. Did I answer your question?
Yeah, I think that was a great explanation of the relationship between like math and orthodontics.
Well, I mean, so I guess to look at the math and the bioengineering, I mean, these are Newton's laws of physics. And basically, there are certain forces that are placed on certain teeth, and it takes a certain amount of gram forces for them to move. And when you understand the way the system works, then you can set up systems, orthodontic systems, that augment and facilitate the best possible way for teeth to move in a biologic system.
Yeah, and I'm gonna actually build off something which you just previously mentioned. So you said that when doing all these procedures, you're using all these physical calculations, all this technology and all of that. And you specifically mentioned in the instance of breaking jaws. So obviously, if you're breaking jaws, there has to be like some sort of idea or methodology behind that. But at the end of the day, you're kind of breaking a jaw, and that has a small risk behind it as well. So when you're performing these procedures, is there any pressure to perform well?
Every day I go to the office, there's pressure to perform well. I try to treat every patient of mine like they're a family member, and I want to give them my best. So whether it's a surgical case or whether it's a routine orthodontic case, it's all the same. When it comes to your dedication to your profession and to the job that you provide for your patients. When we talk about jaw surgery, we're talking about cases in which there's skeletal deformities. In other words, you can't just put braces on and fix every case. The most common thing in the human dentition is an underdeveloped jaw or a micrognathic jaw. It's referred to on the street as a big overbite where the upper teeth are farther forward. Well, we will use orthodontic methodology to be able to bioengineer those teeth and hopefully augment any growth that we have to facilitate those jaws to line up. But in adults that are non-growing, we have to think about other ways of fixing that problem. Sometimes it requires extracting of permanent teeth and camouflaging the distance between the upper jaw and the lower jaw. And still, in other cases that are more severe, we actually have to correct the underlying issue. And that would be the jaw growth or the lack of jaw growth. And in those cases, we would prepare the teeth and jaws and the teeth on the jaws, and then surgically move the jaws into their proper position.
Yeah, so I'm sure that you've had, as an experienced orthodontist, many cases over the years, but is there any specific special case which you feel like really stood out to you? And if so, could you expand upon that?
Yeah. Well, there's, when you're in practice for 35 plus years, you come across a lot of cases. And I tell the young orthodontists that I can give you a test and you can be knowledgeable on a subject. You'll prove to me that you're knowledgeable, but wisdom is taking that knowledge and applying it over countless events. And that just comes from experience. And so some of the cases that I look back on, I've had many cleft lip and palate cases. Those are, genetic issues. I've had craniofacial anomaly cases where facial parts either eyes, mid-face, the maxilla, or jaws didn't grow correctly, where I was part of a multidisciplinary team where I would do the orthodontics, and we would have an oral maxillofacial surgeon move the jaws. We'd have plastic surgery, do other events. So those cases those cases stand out, I think, over the years. It's great to be part of the team, and teamwork makes the dream work. And sometimes when you have these facial deformities, to be able to put a face back together and see them smile is so rewarding beyond words.
So you just mentioned you work like facial parts as well. So do orthodontists work like outside of just like the mouth region as well? Or does it depend on what type of orthodontist you are?
No, orthodontics are dentinofacial orthopedists. So we impact the teeth and the jaws, but we don't do anything outside per se. Where the bone moves and the teeth move will have influence of where the soft tissue moves. So it'll be the plastic surgeons that actually do any kind of facial types of reconstruction, or the oral and maxillofacial surgeons. So we're working on the underlying foundational component of the malocclusion.
Yeah, that's definitely really interesting because it can have like a big impact on not just like the facial area, not just the mouth area, but like the entire face.
Exactly.
All right.
If you think of the face, the mouth from your nose, from the bottom of your nose to your chin, is 2/3 of your face. We call that part of the gold standard of proportionality. And all of this lower part from the nose down is somehow influenced by orthodontics and dentinofacial orthopedics.
Yeah, I definitely agree. Okay, now we're going to move on to some pre-submitted questions we had by like the attendees of our event. So one anonymous person asked, how do you deal with patients who behave in like a hostile way and like don't really want treatment? Like say they don't wear their like equipment properly, or they just don't want help. So how do you deal with those types of patients?
Wow, that's really a good question. Basically, you have to address the fact that they don't want to be treated, regardless of whether their parents want them to be treated. There's a lot of things that we learn during our residency to try to motivate our patients or potential patients. Many people don't want to do things because they're scared and they don't have the information. So if you're able to educate your patients to these, to what we're trying to accomplish, most patients will accept that. And when they start to see the positive influences that orthodontics provides, I think they become part of the team because they're the number one beneficiary. They're going to wear the beautiful smile the rest of their life. Certain times, yes, I have patients, I need them to wear rubber bands. I need them to brush their teeth. They need to wear their neck gear. And I think once you educate them to the importance and that we're only doing it because it's for them, not us, most of them will buy into that. And if not, then sometimes we have to figure out an alternative way to accomplish the goals that we set out to obtain.
Yeah, that makes a lot of sense. And just building off what you said, which also ties into another one of the pre-submitted questions, Anonymous asked, who do you work with in teams when you're performing procedures?
Your team's typically the general dentist who will be providing cleanings and maintaining all of their dental issues. And then the orthodontist basically will do our portion. Periodontists, sometimes we need to monitor the tissue and gums while we're moving teeth around. Oral and maxillofacial surgeons are needed to remove teeth or to evaluate on impacted teeth. So it's typically a multidisciplinary approach, team effort on all cases. I will never take on a case without a general dentist because I'm focused on my specialty, and that's lining the teeth up and getting the jaws and bite to be corrected properly. The general dentist needs to deal with and address the oral hygiene and the other dental decay, etc. And if necessary, other specialties are called in.
Yeah, it seems like you work with a whole bunch of people, and it seems like everyone really contributes to the team. So it seems like a pretty
Yes.
good procedure.
Yeah.
While we're on the topic of procedures, and I think this should be our last pre-submitted question, what was the hardest procedure you feel like you've ever had to do, and how did you handle it?
You know, that's hard to say. First off, you always stay in your comfort level. Okay. And, you know, as an expert in orthodontics, I need to be an expert, and I need to provide expert service, and I need an expert and deliver an expert product. If I don't feel comfortable doing a procedure, I will refer to another practitioner, i.e. an oral surgeon, or even converse with other orthodontists at the university that I teach with for their opinion. So we all try to work together to gain the results we want for the patient. What comes to mind? Sometimes ectopic teeth are very, very difficult to treat. An ectopic impacted tooth, I mean, I have had front teeth coming sideways in the floor of the nose. I've had canine teeth that are supposed to come in at, you know, between 11 and 12, come into the roof of the mouth or in ectopic areas. Ectopic means not where they're supposed to be. So these cases are challenging, but if you break them down and approach them based on your training and experience, most of the time we'll be able to resolve that issue and get an excellent result.
Yeah, that sounds really interesting. And sometimes when it's hard, you have to like persevere through it. So I think that's the end of our time. I think all of us really learned something new. Do you have any final words you want to say to the audience before we finish off this workshop?
Yeah, I mean, first off, it's fun to share this with you. I appreciate the opportunity. I hope it was inspirational. I hope it was informational. At the end of the day, I always tell everyone to follow their passion. You know, don't let anyone steal your dream. If you want to be a dentist, you will become a dentist. Where you have that desire and motivation, it will happen. And it'll open up a great, wonderful career for you. I've loved my job. Of course, you know, it's like any job. There are days some days are better than others. But at the end of the day, when you go home and you know you've been able to positively impact someone's life, there's nothing greater or more rewarding. So follow your dream, and you'll get there.
Yeah, I think those were some great words of advice, and everyone definitely learned something new. So thank you so much for your time, and I guess we'll see you guys all in the next workshop. Bye,
All right,
take
my
care.
pleasure. Bye now.